Well, you know, it's that time of year, flu season, and right now we want to turn our attention to keeping the kids, especially the young ones, healthy during the winter months. And so here to join us to talk about things that you can do and what age maybe the kids should be getting a flu vaccine is Dr. Kumar from the Children's Hospital of Michigan. Thank you so much for being here.
Thank you, pleasure.
Tell me, first off, what age do you recommend the young kids to get the flu vaccine? I've heard different mixed comments about it should be 2 years old, some as young as 6 months.
6 months and above should get the flu shot.
Okay, and does every doctor, every pediatrician give 6-month-olds?
Absolutely.
Flu? Okay.
Yes, yes.
And what kind of symptoms could they get from that?
From
Anything? From the flu vaccine?
From the flu vaccine? If at all, the symptoms are going to be very minimal. A little bit of runny nose, coughing, you know, very mild fevers, and some soreness at the site of the injection.
Okay.
But other than that, it's pretty benign.
Is it the nasal spray that they get?
No, so there are two types of flu vaccines. One is a nasal spray and the other one is a shot. So your doctor will decide which one is better for your child.
Okay. And so it's 6 months old. And
6 months old and above, yes.
And recommend them getting it right now? I mean,
Absolutely.
flu season has technically started.
That's correct. Flu season is typically October through May, and you want to get yourself protected before the flu season starts. Okay. But of course, it's never too late.
What other advice do you have for parents on keeping their kids healthy during the winter months? It seems like cold spreads so much easier when you have the cold weather.
That's right, it does. So washing your hands is the best line of defense. So you want to wash your hands before preparing food, serving food, eating food. Wash your hands every time you cough or sneeze. And when you do cough or sneeze, you want to use your elbow sleeves and not cough into your hands. So regular hand washing after you use the restroom. Really, anytime you get a chance, wash your hands. Okay. That really helps.
You know, the enterovirus, is it still going around like we had seen in the last month or so? What other kinds of viruses and colds are going around with kids right now?
Right, so common cold is always there, and then the flu virus is the big thing this time of the season.
Okay.
Enterovirus is settling down, but we're still seeing a few.
Okay. It's good though that you've seen a decrease in the amount of patients that are coming in to be treated for it.
Yes.
With Halloween being on Friday, we're supposed to have some cold temps, possibly in the low 40s when the kids are going out and trick-or-treating. What advice do you have for the parents on keeping their kids warm and protected and just making sure that they're taking every precaution necessary?
That's right. So you want to keep your kids bundled up because it's going to be extremely cold. And like we mentioned before, get the flu shot early. Wash your hands as often as you can. Stay away from people who are sick. And if you are sick, you want to stay home because you don't want to spread the infection around to everybody else around you.
Now, aside from the obvious symptoms that we would see in children, the coughing, sneezing, congestion, anything else that we should look out for, early symptoms that, hey, take your child into their doctor, make sure they're getting checked out because they could be coming down with something?
So really fever with chills, muscle pains, sore throat, headache, body pains, and really just not feeling well and feeling miserable. So if you have doubts, just call your doctor or take your child to the doctor.
All right, Dr. Kumar, thank you so much for being here.
Pleasure.
We appreciate it. Wonderful advice for all of the parents out there. Stay with us. We'll be right back.